Hi guys, this is Dr. Kelsey Camille from Premier Health Chiropractic up in Coon Rapids, and I just wanted to talk to you and check in a little bit on what's going on with the pandemic here. So a lot of people have been wondering if we are going to be staying open, if we're going to be closing, and what that really looks like as far as the chiropractic world goes. And so for us up in our clinic, we are still open, we are still seeing patients, we're just modifying what that looks like. So in general, without a pandemic world, we're going to be seeing patients that have acute pain, acute symptoms, patients that are on a completely wellness basis that just want to keep their health in check, and then everybody in between. So because of what we're looking at right now, we are only seeing patients that are either in acute pain or who are making sure that we're keeping them from going backwards into a place of pain where if they aren't getting their regular treatments, we know that they're not going to be able to continue doing what they're doing. The reason that we're doing this is because the hospitals, the medical clinics, all of these places are busy enough as it is right now, and they have other priorities. And keeping these musculoskeletal conditions out of there is massively important so that they can focus on COVID and all of these other larger conditions right now. I'm not saying musculoskeletal condition is not large and important, because it obviously can make a massive impact in our daily life. These are things that can be taken care of outside of those facilities, and that's what we want to make sure that we're doing here. And so in order to make sure that we're creating the safest, healthiest, most secure environment for our patients, steps that we're taking to ensure that we're only having one patient or one family group in the clinic at a time. So we're scheduling certain time periods for that. Typically, we would normally allow kind of like a walk-in time or groups of people at a time. We're not doing that anymore. It's always by appointment, so we can make sure that we're keeping only one person or one group in at a time. We're having everybody do a questionnaire, a symptom questionnaire, as well as asking that anybody who's traveled within the last 14 days, just wait that 14-day period out before coming in. We're also taking temperatures to make sure that anybody who has a fever is waiting out before they have a fever coming in, because a lot of times we just don't even know that. And then we're also making sure that we're sanitizing, just like everywhere else that you talk to. We're sanitizing. Myself and any team member that is in the clinic is wearing a mask to help prevent our germs from coming in contact with you. The masks don't necessarily prevent your germs from coming in contact with us, but we have masks to prevent our germs from coming in contact with you, to make sure that we can protect any extra germs from coming into your world. And so those are big steps that we're making sure that we're taking to keep you safe as you come in and out of the facility here. And so I know a lot of people are kind of on the fence on whether they should come in or not, even knowing all of those things. If you have questions or concerns, I encourage you to call or email or reach out in any capacity that you feel comfortable, because I want to make sure that you feel good about coming in and you feel right about coming into the office. So I am offering virtual consults as well, just to have a one-on-one discussion to see if this is right for you. And that's for new and existing patients, so that we can really figure out if coming into the office is that best fit. Because we want to make sure, like I keep saying, that this is an appropriate setting for you to be in at this time, as well as making sure that chiropractic and this clinic is the right fit for you. So I hope that everybody is staying safe, they're staying healthy, and we can help to make sure that we do our part in keeping the society and this whole pandemic under control. Have a good one, you guys. Bye.